You're watching Life Network, an Alliance Atlantis network.
Hi, I'm Deborah Kelly. Welcome to Diagnosis MD. Today's topics are rosacea, blackheads, glycolic peels, latex allergies, and ringworm. Joining us today are Dr. Paul Cohen, a dermatologist, Dr. Martie Gidon, a dermatologist, and Dr. Charles Lynde, also a dermatologist. Our first topic today is rosacea. Over 1.4 million Canadians suffer from rosacea. Rosacea strikes men and women in their 30s to 40s. Those with fair skin and blue eyes or of Celtic origin are much more likely to get rosacea. Now, rosacea can be very embarrassing for some people and also make them less apt to go out publicly. Martie, what can you help people with in these situations?
Well, usually patients come in and they say that their face is red. And you take a look at them and they do have redness, and the redness is usually caused by small spider veins on their skin. And sometimes you can see obvious purple little veins. The next stage of acne has little pimples. They can be little whiteheads or almost like little water blisters, and patients say they break quite easily, they last for a day or two, or sometimes they do have the occasional stubborn one that can last for several weeks. But it's really the redness that bothers them.
Paul, what triggers a rosacea flare-up?
There's a lot of things that can cause rosacea to flare. Spicy foods, hot beverages, sun, wind, exercise, stress. All these things can make people much more red in the face, so we try to tell patients to limit their exposure to certain of these triggers as much as they can.
And Charles, what treatments are used for someone with rosacea?
Well, rosacea, first of all, I think you have to tell people there isn't, unfortunately, a cure for the condition, but there are many things that can improve the condition. Various topical creams, particularly those that have topical metronidazole, are things that can decrease the overall redness and particularly the acne part of the condition. Various camouflage things can be used to sort of hide the redness that people are complaining about, and even different lasers can be used to get rid of the small little veins and the overall redness.
Martie, Charles mentioned camouflage cover-ups. Does that include makeup as well?
Yes, if someone has just mild rosacea and they're just a little bit pink, sometimes just a light powder will be enough for them. But as the redness increases, there are more camouflage makeups that are available. One is Cover Effects that does a very good job of covering the redness. It comes in a cream form or a liquid form for someone who doesn't need quite as much coverage, and it does contain sunscreen as well.
Paul, when people originally present themselves, do they think that it's acne that they're suffering from?
Well, sometimes they do. If they have a lot of pimples, they think they just have regular acne. But if they have pimples in addition to flushing and blushing and broken blood vessels, then they more likely have rosacea. But a lot of people do wonder if it's just plain old acne that they have.
And Charles, what about the self-esteem issue?
Well, certainly there's a problem there. People that have sort of a bigger nose, the rhinophyma, like a W.C. Fields nose, certainly look a little bit hideous. Other people just have the overall redness and flushing, and if it's just mild, people kind of like that, but if it's much more, they just certainly don't want to go out in the public that way.
And if patients do have flares, then sometimes I will treat with an antibiotic by mouth, especially if they know that they're coming into a stressful situation and their rosacea will flare. I'll cover them with an antibiotic for a few weeks, just so they'll feel more comfortable going into that situation.
Just another thing that's important to relate to the viewers is that the newer lasers, in the past we were treating red blood vessels on the face. We'd have to bruise the skin and the face would look purple for up to 2 weeks, but now with the newer laser technology, you can have laser treatment to help with the redness, and you can go back to work the next day.
Which I think is very important for a lot of people, or if they have a social function or anything. And also, Paul, are there any environmental factors that someone with rosacea should be avoiding?
Well, they really have to be careful about their sun exposure. Intense sun can really make the face look red. and also intense wind. So all these patients have to wear sunscreen on a really regular basis. They should be wearing a hat as well. And in the winter months, a lot of people with rosacea have to wear a scarf around the face to prevent the skin from getting too red.
Rosacea used to be called acne rosacea, but the ailment does not resemble acne in anything but superficial appearance. No blackheads, whiteheads, deep cysts, or lumps occur with this ailment.
Good love is hard to find.
A perfect mismatch.
Who will move in with her and spend the next 7 days trying to win her love?
It's gonna be a rough night.
Perfect Match, tomorrow night at 9, after Matchmaker, on Life Network.
Can I help you with something?
Yeah, I'm here to skate.
You skate? Stuff.
12 kids?
A dozen?
12.
Raising kids, it's an adventure.
Clean up on aisle 12!
Things are getting pretty twisted around here.
You soaked his underwear in meat.
Bring home the family fun.
Funny, but wrong.
Cheaper by the dozen. Buy the biggest comedy tomorrow.
Time and weather can make concrete look bad. Fix it with Techstone Granite by Beauty Tone. Only at Home Hardware and Home Building Center. An easy way to beautify and protect steps, balconies, floors, walls for as little as $1.70 a square foot in 3 simple steps. Prime with granite primer, trowel on Techstone Granite, seal it. For a slip-resistant surface that stands up to water, salt, and lots more. Now that's a step in the right direction. Techstone Granite by Beauty Tone, only at Home Hardware.
Turkey. It's turning up all over. Try it in tacos. Ground turkey is lean and easy to prepare. Turkey makes a good recipe taste better.
PharmaSave knows sometimes you just need a little nighttime comfort. We're here to support you with warming herbal tea, perfect sleep accessories, and soothing night creams. Because when it comes to your wellness, we care. One stop, one goal to help you live well.
Live well with PharmaSave.
Is that a dragon I see?
Yeah.
You like dragons?
Yes.
And you're coloring it green. Perfect. Can I have a clip? Thank you.
Acne affects over 85% of teenagers and young adults. Blackheads and whiteheads are medically termed comedones. Studies have shown that 2/3 of teenagers want to talk to their physicians about acne, but less than 1/3 actually do. Charles, when you have these kind of statistics, how can you actually sort of break that or establish that bridge between, say, a teenage patient and yourself?
Well, I think it's very important to make the teenager feel at home, that they can talk to you about their problem, and to listen to them. I think it's very important. Teenagers want to be listened to. They want their acne treated, and I think you have to listen to them and treat it.
To break that barrier can be very difficult. Maybe sometimes, too, young girls might feel a little bit more comfortable talking to someone like yourself, Martie, because they might suggest that they go on the birth control pill for their acne.
Well, sometimes patients come in for different problems, and I do have information in my office, so just anonymously they can pick up information about acne, take a look, and then they may feel more comfortable talking about it. If they don't say anything and they've come in for a different problem, I sort of get a rapport with the patient and deal with their concern at the time, and then I may say towards the end, well, would you like me to give you something for your breakouts, and just sort of ease into that conversation. And more often than not, they'll say, oh yes, you know, what can I do for it?
And Paul, I think we can also say that don't be picking a lot of your blackheads and pimples at home. I think that's a common thing that young people do, and then they can cause even more problems to the skin.
Well, absolutely. If you're picking at your skin, you can develop scarring and infections. So it's a very good idea to have your dermatologist assess your blackheads and whiteheads, because there are a lot of medications to make this better, which will hopefully keep kids and adults' hands off their face.
Charles, I think another thing that we can say is that it doesn't make a difference how hard you scrub. I think people have this misconception that if they scrub their face a lot harder, then they're not going to get the acne. And the acne is actually occurring in a deeper section of the skin. Maybe you can explain it to us.
Yeah, a lot of young women particularly like to scrub, rub-a-dub-dub, and actually try to scrub away those blackheads and scrub away the acne. My approach is sort of to hands off a little bit and make them do it just a little bit less vigorously and do it very gently. Because the acne really is related to hormones. Those hormones cause the sebaceous gland to produce far more oil than they need to, and that then produces a blocked comedone, which then can be inflamed and produce not only the comedone, but actually a little inflamed papule or pustule on the skin. So these often have to be treated not only in terms of gentle washing, but a lot of other treatments can be used too.
And I tell patients that it isn't dirt that causes the blackhead. It's really pigment in the skin, so they have to be very careful and not to scrub because it can cause more inflammation.
And speaking of treatments, Martie, is there over-the-counter medications that people should try initially?
For blackheads, the best medication is tretinoin, which is only available on prescription. If they're younger and just starting to develop small blackheads, they could try some salicylic acid products that are available over the counter, or a mild benzyl peroxide, but really the tretinoins are the best creams for that.
What about flaking skin or dry skin, which can sometimes happen with, you know, the retin-A's and things like that, Paul?
The important thing is when you're using these medications that you use the right amount. And I often tell patients that they need to use a pea-sized amount to cover their entire face of any of these retin-A or tretinoin type products. Overuse does not make the acne go away better, faster. It makes your face red and irritated. So a little small amount is all they need. They need a little bit of patience. These medications take a while to work, and they really have to wait it out, and then they'll start to see the benefits.
Sometimes they can back off, and instead of doing it every day or every night, they might do it every second night. I also have them sometimes use a mild moisturizer to put on to counteract the effect of the retinoid.
And sometimes even just staying away from those perfumes and those moisturizers makes a difference.
Yes.
Right, and they should make sure that their products are non-comedogenic. Comedogenic means causes blackheads, so moisturizers, makeup, any product that touches the face, you have to ensure that the patient is aware that it's oil-free and non-comedogenic to ensure that the problem gets better.
And the tretinoins also make you more sensitive to the sun. So being careful in the sun and wearing a non-comedogenic sunscreen is important.
It is important to note that not all acne is the same. Blackheads and whiteheads are different from red bumps, and both forms of acne require specific treatment. Recent studies have shown that glycolic peels can help patients with acne and rosacea. Glycolic peels are considered the lightest of the chemical peels. Research has shown that glycolic peels can make the skin more responsive to other medications and procedures as well. Now, Paul, because glycolic peels are so advantageous to the skin, how often can someone actually have a glycolic peel?
Usually they're performed once a month, and people tend to do a series of 4 or 5 peels. And just after 1 or 2 peels, you'll start to see the benefits. Again, it depends on what you're treating. With acne, you can see the benefits a little bit quicker than if you're treating wrinkles, because glycolic acids are also used to treat wrinkles, but usually about once a month.
Now, Charles, immediately after a glycolic peel, can you go out in the sun?
I usually recommend to my patients that they don't. Going out in the sun right after getting a glycolic peel sometimes will produce some hyperpigmentation on the skin. So I certainly try to get them to avoid sun for at least a week after a glycolic acid peel.
Now, is there any pain associated with a glycolic peel, Martie?
No, not really. It feels like sort of an itchy, tingling sensation, and at some point it might start to feel warm, and then it's washed off. Afterwards, there might be a little bit of flaking for a few days, and patients can put a moisturizer on, and they should avoid the sun, but there really is no pain involved.
Now, Paul, is there different tolerance levels for people with glycolic peels?
Absolutely. People with rosacea, for example, with very sensitive skin, they might have a very difficult time tolerating these peels. People in general who say their skin is sensitive usually should start at a very, very low concentration of glycolic acid to make sure that they can tolerate it. In other hands, people who are a bit older, have had vitamin A acid or tretinoin-like treatment on their skin before, can tend to tolerate higher concentrations of the acid without any problem.
Now, can any complications arise from a glycolic peel, Charles?
Yeah, sometimes people get a marked redness that may persist for a couple of days. Very rarely, if they've already had a little abrasion or something else on their skin, the glycolic acid can get in there and again cause some irritation to that area. And very rarely, it can reactivate their herpes. So sometimes people that have herpes, cold sores around their mouth, getting a glycolic acid sometimes can reactivate that. But that's a rare problem.
But usually if they have a history of cold sores, we ask that in our history, and I'll start them on an antiviral medication 2 days before their peel. So that really shouldn't be a contraindication to having a glycolic acid peel.
And what about all the other peels that are out there and available? Would you say that glycolic is one of the more safer?
Well, glycolic acid peels are certainly the lightest peels.
So the least invasive?
Yes. But if you start going into the deeper peels, there's a trichloroacetic acid peel, which is a medium peel, and there is downtime. It can take about a week for that to clear, and you can have quite a bit of redness and flaking, scaling, and crusting with that. And then, of course, there's a deep phenol peel, where you really should have it done in a hospital-like setting, and you're hooked up to an ECG monitor, and you have an intravenous line. So that's definitely a more invasive procedure.
I think it's important to recognize that the deeper the peel, the more likely of a problem, particularly even scarring sometimes with a phenol peel or trichloroacetic acid, but you don't get scarring with a glycolic acid peel.
Glycolic peels are often called a lunchtime procedure. This refers to their short duration and relatively brief recovery time.
You hope to never meet them. My health was being affected drastically. You're afraid of what they might say.
You know, surgery, there are risks, there are concerns.
But they're your last chance at survival.
As the patients leave with a smile on their face, I think we've had some success. I like to think that I'm making a difference.
Intense, personal, inspiring. The Surgeons, tonight at 9 on Life Network.
Love to get back your hair's fullness and strength? New from Pantene, introducing Full and Thick. Created for millions of women with thin hair, the amplifying Pantene Pro V system penetrates deep into every strand. Hair looks thicker and stronger in 10 days, guaranteed. Now you're looking full and thick again. New Pantene Full and Thick. That's the beauty of healthy looking hair.
Kids don't always make the best choices. But at McDonald's, every choice is good. They can choose their favorite Happy Meal food and a drink like milk or juice. Try new apple slices with caramel dip. McDonald's. Loving it.
It's the Honda Gear Up for Spring event. Get great Honda value on our world-renowned Accord. Or Civic, Canada's #1 selling car, from $188 a month. The Honda Gear Up for Spring event. Visit your Honda dealer now.
Each year, Lynde brings you a special Easter secret. One with 2 long ears, a shiny coat of gold, and a magical ribbon. And inside, our finest chocolate, the Gold Bunny from Lynde.
Old pals.
Don't shoot, it's on! I know!
New problems.
Cynthia's been kidnapped.
And a rude awakening. Bruce Willis, Matthew Perry.
Thank God the killers are here.
The whole 10 yards.
Starts Friday, April 9th.
Okay, move it along, people. Move it along. Move it along. Okay, yes, go down. Ready? Oh, you're good. Perfect. Yes. Put your face down. Come on.
Latex allergies were first recognized in the 1970s in the United Kingdom. Today it is estimated that 8 to 12% of healthcare workers are latex sensitive, while 50 to 60% of children with spina bifida will develop latex allergies later on in life. Martie, when we look at these statistics, it's actually quite frightening, and especially for someone like yourself who's in the healthcare profession, and there seems to be latex everywhere, not just in gloves, they're in catheters.
Yes, there's latex really in anything that is made of rubber, and certainly in gloves, and we have to wear protective gloves, so it can be a big problem. Also,
intravenous tubes, syringes, all those things.
Yes, but sensitivity is usually the main problem, and the most common problem that I see is an eruption on the backs of hands. But gloves also have powder inside usually, and these puffs of powder can contain the latex particles so that they can become airborne, especially when you take off the gloves. So not just the doctor in the room, but anyone else, including the patient, can have a problem and actually can develop asthmatic type of symptoms with wheezing.
Well, not even just asthmatic type symptoms, Paul. I mean, it can be as dangerous as anaphylactic.
Absolutely. There have been lots of case reports of people experiencing anaphylaxis, being in contact with latex or even the powder. So it's something to be very, very aware of, and you have to be cautious in any setting, especially if a patient has a latex allergy.
And then there's latex that can be found, Charles, you're going to kill me, but you get the condoms.
Well, it's certainly a problem in that if people are allergic to it, then obviously the male that's wearing the condom can run into problems with chafing and irritation on the genital area, and so can his partner.
And why are people more likely to have certain allergies towards foods when they have latex allergies?
There are certain foods that cross-react with latex, and these foods are kiwi, banana, horse chestnuts, avocado, I also believe.
Now, aside from certain allergy reactions, Paul, do you ever find that sometimes maybe, especially like a healthcare worker who's just washing their hands profusely every time they take off gloves, that maybe they're just getting, you know, a rash towards the soap or something like that?
Absolutely. This is a very common problem. It's called irritant dermatitis. People think that they're allergic to latex, but they're actually reacting to the amount of water and soap that's hitting their hands. So a lot of people erroneously believe they're allergic to latex, but what's really happening is the skin is just getting irritated from repeated washing, or the hand chemicals that they use, or the hand sanitizers. They might be reacting to a component of that product.
And you can be patch tested to see if you truly do have a latex allergy.
And let's say, Martie, that you really do have a latex allergy. What sort of procedures does the hospital take when they know that a patient is coming in for a surgery and they actually have a latex allergy?
Well, I think they would try and avoid latex products as much as possible and just be ready for any emergencies.
The latex in latex paint is different from that used in most latex products. Latex paint derives its latex from a synthetic source, and it does not harbor any of the triggers associated with latex allergies.
I'm a big kid, look what I can do. I can wear big kid pants too.
New Pull-Ups training pants are just like big kid underwear. They go off and on. And now come in Disney Pixar's Buzz Lightyear for boys and Disney Princess for girls.
Mommy, wow! I'm a big kid now.
Don't I know you?
Yeah, thin crust. I used to deliver you pizza.
I don't see you anymore.
You don't order pizza anymore.
New Delisio Thin Crust Pizza. It's not delivery, it's Delisio.
Can I have half?
Forget it.
Robert.
Dad!
Cheese whiz. You know you want it.
Our actions define who we are. So if your love for the environment is as strong as your desire for power, and if you would never sacrifice safety in the pursuit of having fun, or function in the name of style, and if you believe that a sedan need not be sedate, act accordingly.
These are our laboratories. These are our subjects. Adidas Active for men. Antiperspirant with sweat-activated smart technology. The harder you sweat, the harder it works. Adidas Active. Athletes get it.
Also available, Adidas Active Antiperspirant for women.
Ringworm is not caused by a worm at all. It is caused by a fungus. The medical term for ringworm is Tinea corporis. Ringworm comes from the group of fungi called dermatophytes. Now, ringworm can actually be transferred from animal to animal, human to human, and how long is it contagious for?
Well, it is not a highly contagious sort of thing, but certainly if your cat and or your dog and you're cuddling with that cat or dog, certainly you can get it from them. More commonly, it's person to person. So again, it brings out the importance of personal hygiene.
No fear from extraterrestrial to extraterrestrial.
I don't think so. Not yet.
That's lucky for us. Yeah. Now, with ringworm, it sometimes can be serious, Paul, and if it's left untreated and undiagnosed.
Well, many times a physician might misdiagnose ringworm as eczema, and they'd prescribe a cortisone cream. And in fact, this will make the fungus grow and make the fungus worse. And sometimes the fungus can grow down into the hair follicles. So if you have ringworm on your arm or your leg that's been misdiagnosed, you might eventually need to take pills rather than a cream to get rid of it. Similarly, if you get ringworm in the beard area or the scalp, you most likely will have to take pills to get rid of the infection.
So aside from flaking and itching and burning, Martie, what else do we see?
Well, often it starts as a little red bump, and within a few days it starts to spread and flatten, and it's quite flaky, scaly on top, and then it starts to spread out in a circle, and the center starts to clear, especially if you've been using a cortisone cream. And I think that's where it got the name ringworm, because it expands in a ring.
So it looks like an actual ring.
Sometimes it's so itchy that people scratch at it a lot. They then get secondarily infected with different other bacteria, and you can actually go on to get a more serious infection like a cellulitis because of that too.
And spread the tinea itself, the fungus itself, to other areas of their body.
Now, if you actually spread it to other areas of the body, Martie, what are we talking about? Is this like jock itch, things like that?
Well, if it's in the groin area, that's certainly what it's called. But usually when we talk about ringworm, you continue to have these round little circles of redness and flakiness that just spread. So for example, if it's on the arm, you can just continue to get more of these spots on the arm, or it could spread to your abdomen that's adjacent to that arm and then spread across to the rest of your body.
And then, of course, is it more difficult to treat if it's all across the body, Paul?
Well, sometimes if it's more extensive, the usual antifungal creams don't work and you require oral therapy. It's very challenging sometimes to treat ringworm of the scalp. In ringworm of the scalp, you might see a bald spot, a child might complain of itch and flaking, and this can be very difficult to treat.
The incidence rates of ringworm infection appears to be growing, especially in schools and other group activities where children gather. Thanks to all the doctors who appeared on today's program for providing their invaluable advice and insight into the problems facing medicine today. If you have any questions or concerns about these or any other medical topics, consult your doctor. That's it for today. I'm Deborah Kelly, and we'll see you next time on Diagnosis MD.
Remember the first time you experienced the freedom of accessing your money outside bank hours? Today, specialists in mortgages, investments, and insurance come to you. But it doesn't matter how often we're first, unless it puts you first. RBC Financial Group. First for you.
Home on the Range is one of Disney's finest. Sophisticated for adults and thrilling for kids.
Awesome!
It's funny, dazzling, a total joy, and 110% pure Disney fun. Walt Disney Pictures' Home on the Range, now in theaters.
Say, girls, got milk?
Something on your mind? If you think you might be pregnant, Clear Blue Digital Pregnancy Test is the first test with an easy-to-understand digital readout that clearly shows whether you're pregnant or not pregnant. Get accurate results from the first day you miss a period. It takes as little as a minute, so you can be 100% clear. Clear your mind with Clear Blue.
The first real test of marriage.
I think it has great potential. It's horrible.
Is combining your stuff.
It's merge time.
Lisa Rinna and her team try to make it a smooth transition.
So we are here to save the day.
With help from the Shredder.
Woo! There's my share.
Shred them! Woo! They're gonna die when they see this.
The results are revealed when they return from the honeymoon. Merge tomorrow at noon after House and Home on Life Network.